I'm Grazia Aleppo, and I'm a professor of medicine in the Division of Endocrinology, Metabolism, Molecular Medicine, and Northwestern Medicine in Chicago. When we think about the use of digital health in today's medicine, especially for our patients with diabetes, we can identify people who need help and need the help today. By doing so, we can accelerate the referral process, the appointment process, so taking care of the patient in an early phase to avoid late-term complication. When we think about designing or implementing digital tools in clinical practice, we need to think about who is using them, what is the purpose of them. It's not just to have numbers, rather can the providers use these tools easily throughout their day instead of making another burden for them. And once they use it easily and effectively, then the patient benefits from identifying problematic area, BMIs, hemoglobin A1C, kidney function that is going down, elevated cholesterol, and things like these. Today, there are three kinds of continuous glucose monitoring systems. The first one is the professional CGM, which usually is owned by the practices. The patient uses it on a sort of occasion basis. The personal CGM is once the patient has used a professional CGM, they usually don't want to leave it. They want to stay with it. And so it allows the patient to see the glucose levels and their trends. They know what a particular meal could do for them or not for them so well. They can see how much better the glucose levels may be after exercise routine, for example, and guide the patient to sort of self-manage, which is the mainstay of diabetes therapy. The third type is the over-the-counter CGM, also called biosensors. These are for patients who have diabetes or no diabetes. They are not on insulin, or they want to just see for lifestyle management their glucose levels, and they give you insights on the glucose spikes and what might cause them, and very good apps to give you some sort of information on how to improve your metabolic rate, your glucose levels, the postprandial excursions, and what you want to do better for yourself. At Northwestern, we have developed our RPM program, remote patient monitoring, by successfully integrating one of the CGM in the market through the Epic electronic health records. We really are one of the few institutions in the country that have done this successfully. We actually published our method to just show how we've been able to integrate one of the CGM makers into electronic medical records. A couple of challenges, of course, is to make sure that the patient is enrolled when they are invited. The other challenge is to help the primary care providers or any provider to become comfortable as to where to find the information and how to interpret it. For this reason, we published a paper to say 3 easy steps on how to read and interpret CGM in primary care. The purpose is to gather information. When the patient has integration of their CGM in the electronic health records, here at Northwestern Medicine, the cardiologist can see the glucose levels, the primary care can see the glucose levels. Remote patient monitoring has enhanced our care for our patients in a great way. This is a game changer for the patient and also for us providers, having the knowledge that we can see what are the specifics of the glucose levels, what can we actually pinpoint and use the new medication that can address those very challenges these patients are facing, and not just think about the A1C alone. So I think about the future and think, how can we make CGM system better? There are some studies ongoing looking at continuous keto monitoring, and this would be so helpful for people, for example, who are using insulin and might have elevation of ketones together with elevation of glucose, but also for people using particular drugs that can put them at risk for elevated ketones. We also are hoping to see CGM that will work together with activity monitors and say how much better that the glucose will get, or, for example, how to avoid hypoglycemia in people who use insulin who do activity because it's concerning to them. Also, I'm thinking always about miniaturization and using phone apps, maybe watch apps, and truly make the life of the patient much easier. And also remove the feeling of there is something attached to my body, so the smaller the better. I also think about how can we integrate, for example, heart rate. Can we make this system to work together for not just the glucose, but also pulse ox, blood pressure, or maybe think about this system in the inpatient setting when you don't have to have so many things attached to a patient, or a little thing attached that can measure so many things and so give more information to the patient. Like we've done with Holter monitors, they're smaller and smaller. Why can't we put it together with a CGM?